40 years ago, my husband and I started our construction company, Garbett Homes. I did the books and I found insurance for us. It wasn't that great. When I went to have my second child, the hospital had us wait in the lobby while I was having contractions because we hadn't quite paid off the bills from child number one. Providing health care insurance has changed over the years. More and more is required of the private sector. When our company lost our HR director during my bid for Congress in 2018, I returned to cover this complicated task. How different it was then than when we started 40 years ago. We were at the mercy of skyrocketing insurance premiums. I remember wondering, how could we possibly do our business and provide health care coverage for our employees? I thought, do we give them a paycheck or do we give them insurance? It's particularly hard to balance those needs in a small business. It's difficult to compete. It's difficult to compete with the large companies that have thousands of employees. When you have 50 employees or 500, you do not have the bargaining power with insurance companies that someone like the state has. I remember one woman who wanted to work for us and came from a previous business that had thousands of employees. She had a family of 7, and we simply couldn't afford to match the insurance coverage that she was leaving. Local businesses are at a huge disadvantage compared to large public companies. It's as much a nightmare for the employer trying to navigate the bureaucracy as it is for the patients. I remember mutual frustration with the process when one of our employees, recently married and living in her parents' basement, wanted to start her family. We looked at maternity coverage. Unfortunately, the only affordable resolution required spending more years in her parents' basement. I wanted to help her, as I think most small business owners want to help their employees, but I was powerless to do what needed to be done. I know we're not the only Utah employer who's felt that way. Small businesses such as ours comprise over 99% of businesses in Utah. We create 46% of the state's private sector workforce. Yet we have essentially no negotiating power when it comes to improving the health insurance we can offer our handful of employees, and we simply can't afford the human resource staff needed to navigate the complexities of the overgrown business of health insurance. Small businesses are burdened with navigating the system at a starting point of loss, and we are forced into these costs by the current health insurance system. We went into business to do business, not health insurance. But it doesn't have to be this way. I am supporting Common Sense Healthcare for Utah's ballot initiative because it will free small businesses like ours from the bureaucratic burdens of having to provide health insurance, and let us focus on what we're good at, our businesses. And we can do so knowing that our employees are getting the best health care possible. Utahns deserve to be treated fairly, employers and employees. And with this ballot initiative, we all can be. I invite members of Utah's business community to join me. Come to the listening tour events Dr. Jarvis just announced. Business stories are welcome too. Join our cause and let's get rid of the burdensome red tape of health insurance. It will save us money, time, and more than one kind of headache.